The pandemic is proceeding mostly badly, but there are a few bright spots. So let's give you the good news and the bad news here. First of all, some bad news though. This is an amazing threshold that we have now crossed as a country. According to Kyle Griffin, 20% of Americans have now been infected with COVID over the course of the pandemic. That is what Johns Hopkins, who's been tracking infections, now says. And let's keep it real, as we always do. That is 20% of Americans have been officially tested as having had COVID. Nobody thinks that nobody has COVID who hasn't been tested for it. So is that 22%? Is that a third? Is it 50%? I don't know. But this is, let's just keep it real, a massive failure on the part of American government, certainly, the American people, American society, our political culture. I don't know. There's a lot of failure to go around and a lot of COVID to go around, seemingly. But that said, while there has been a lot of COVID and still is a lot of COVID, there are some positive signs coming from certain areas. New York and other northeastern US states are now seeing what is being called a rapid fall in COVID cases. And that's good, because right now, even in those areas, a lot of hospital systems are already strained to the breaking point. But you can see if we bring up this chart, the average daily cases, which is sort of a rolling average over a period of 1 week there, is finally starting to go down after rising consistently for nearly 2 months there. And if we look specifically at New York, you can see that the average is falling even more rapidly. Now that is still tens of thousands of cases a day, and the most recent numbers are lagging a bit because of the holiday, but that is certainly a good sign and sort of what we would expect, especially when so many people get it in a short period. You start to run out of people who haven't already had it, I suppose. But yeah, they're down to less than 20,000 a day. They'd been averaging over 40,000 a day as recently as the 9th of the month. And they're doing a lot of testing, 400,000 tests conducted in just New York on Saturday there. And the positivity rate is down as well. It looks like some of the information says that New Jersey, Massachusetts, Connecticut, and Rhode Island, the rest of the region is also starting to go down. They've been very hard hit for some time, so that is certainly good news. But that said, in certain areas, including the Bronx and New York City, staff at hospital facilities have issued calls for help, saying they're struggling to treat a surging patient load. Quote, patients are lying in the hallway on stretchers that are touching each other, says Karen Lamb. Now, I assume everyone or virtually everyone there already has COVID, but still, the idea that in any hospital system in the United States, we would have to be just like corralling people in a hallway while waiting for doctors and nurses that can help them is a massive disappointment. And the cases are going down, but as we know, when the cases are going up, there's always a bit of a lag in seeing the effect of case numbers on hospitalizations and deaths. So we are still seeing a rise in deaths and hospitalizations, but this at least shows that in some of the areas that have been hardest hit during this most recent wave, we should see a little bit of help coming in a few weeks if this direction in cases continues the way it is. And it's a complicated thing that leads to the diminishing of cases. It's possible that some of the increase from holiday travel is finally starting to burn out. It's possible that, as in past waves, the media talking about it a lot, people starting to take it seriously again, takes a little bit to finally kick in and be reflected in the numbers, but it is finally going down.
For more political news breakdowns, interviews, stories of activism, and me trying my hardest to care about the occasional big celebrity news story, subscribe to our YouTube channel at youtube.com/thedamagereport. And you can ring the bell wherever it is so you don't miss anything.